So, hi everyone. My name is Kevin Apgar. I'm one of the senior provider relations manager with NIA. Now, NIA is also a subsidiary of Magellan Healthcare, so some of you might be familiar with us through Magellan Healthcare. Now, my goal today is to talk about the transition from health help for their advanced imaging and cardiac medical necessity prior authorization process. Starting on October 1st, NIA Magellan is going to be taking over managing all of the outpatient prior authorizations for those advanced imaging and cardiac procedures. I'm also going to briefly discuss how the ordering doctors are going to obtain the authorizations, where the rendering facilities can actually view all of the approved authorizations. And then I'm also going to talk about, we're going to have some webinars in the middle of September. So for all the staff that is not able to attend today's seminar, they can attend one of our webinars. So we're going to have 8 different sessions in the middle of the month of September. So I actually have on the table out there a webinar flyer with the dates and the RSVP information. So again, starting on October 1st, Health Help will be going away, and Magellan Healthcare is going to start managing the outpatient and cardiac prior authorizations. So you can see over here on the left-hand side of the screen, the modalities that are going to be included are going to be the MRIs, MRAs, your CTs, your CTAs, PET scans, your CCTAs, then you start getting some of your cardiac procedures. So it's going to be your MPI procedures or your nuclear card procedures, MUGA scans, stress echoes. Also, currently, what we manage today is the in and outpatient lumbar and cervical spine surgeries, and that was in place since of January 1 of 2015. Now, if any of the advanced imaging or cardiac procedures over here on the right-hand side of the screen, if they're performed in a hospital inpatient observation, emergency room, urgent care, or surgery center, they would not require an authorization through Magellan Healthcare. You're going to follow your same process as you are today. So if there's a authorization process for those inpatient procedures, you're going to follow your same procedures as they are today. I do also want to mention we will have a soft go live. So on September 28th, we will start accepting authorization requests. Also want to mention that if you have a Health Help authorization number, there will be a transition of care, so those authorizations will be valid for 2 weeks afterwards, so you do have some time to start getting those authorizations after that October 1st date. So now that you understand which exams are going to be requiring an authorization, we've also put together a CPT code matrix. So over here on the right-hand side of the screen, you can actually see the CPT code matrix. The way this matrix will be utilized is it's actually out there on our website, all of our educational documents, FAQs, quick reference guides, clinical guidelines, and the CPT code matrix, they're all housed out there. When we do authorize a procedure, we'll always authorize in this grid here, the code's on the left-hand side. So for example, if you're ordering a CT head brain, which is the 450 code, we will also include in that authorization the 60 and the 70 codes. The only time you have 2 different authorization numbers is, for example, if you're doing the CT head brain and the CT orbits, you would have 2 different authorization numbers. But if you're doing it within those allowable billing groups, which are on the right-hand side, it's 1 authorization number. The authorization numbers, once you do have one, they are valid for 60 days. So if they do fall outside the 60-day window, you would have to contact NIA to update the actual authorization itself. So the responsibility for the authorization, the ordering physician is going to be responsible for obtaining the authorization. We have 2 different ways for the ordering physician to obtain that authorization. They can either do that online through our website. So our website is www.radmd.com, or you can contact us through our call center. Now, once that authorization has been approved, the rendering facility must verify that the authorization is there on file. We do have an online portal for the rendering side of the business too, and all of the approved authorizations will appear in their online account. So again, they would go to the same website, radmd.com, and they can view all of their approved authorizations. Towards the end of today's presentation, I'll kind of briefly walk everyone through on how to get signed up for an online account. So this is an overview of the authorization process. So the ordering physician is going to need to determine the appropriate exam and gather all the necessary clinical information. I do highly suggest for the ordering physicians and their office staff to review your top 5 to 10 exams that you're normally ordering for and become familiar with those clinical guidelines. Again, those guidelines can be found on our website on radmd.com. Now, once the ordering doctor has chosen the appropriate exam, gathered all the necessary clinical information, they can then initiate the request. As you can see, there's 2 different steps here to initiate a request. It could be done either telephonically or it could be done online through radmd.com. At intake, so if it's coming through our call center or online, the clinical questions will be driven by our computer algorithms. These are yes, no, multiple choice type questions that help us determine that this is the most appropriate exam that's being ordered. In certain instances, the patient's medical records will also be required. So in the cases after you've gone through the actual algorithms in the first initial step, we will send out a clinical fax to the office requesting the patient's medical records. So it's very important that the information in the patient's medical records are aligned with our guidelines. So again, that's why it's important to actually review the clinical guidelines to make sure everything's documented appropriately in the records. Now, once we review the information that's been submitted to us, the service would be authorized. Again, at that point, you would get an authorization number. Whenever a request is actually pending, we do give out tracking numbers. Tracking numbers are strictly numeric, so there's never, they're strictly numeric. Authorization numbers are alpha and numeric, so that's how you can tell the difference. At this point, this is when, once it's authorized, the rendering facility can then perform the service. First, they're going to verify and then perform the service. And then the good news is the claims process is staying the same as it is today. So no changes with the actual claims process. So here, this slide is highlighting some of the general and clinical aspects of the request. So at intake, we'll be collecting the general information. So this is going to be the demographic information, ordering physician information, rendering provider, exam, patient information. And then there's the clinical aspects of the request. So we'll be looking for any information to justify the exam. A lot of the MRIs will require conservative therapy notes. So that would be a physician-supervised home exercise program, PT, a series of anti-inflammatories, rest, ice. All that information has to be documented in the actual patient's medical records. We'll also be looking for x-ray reports, any lab work that's been completed, ultrasound reports, and then the reason why the study is being requested for further evaluation or to rule out a specific disorder. Again, it's very important. I can't reiterate enough to review those clinical guidelines. It will help you with the transition going from Health Help to Magellan Health. So when you are requested to send in patients' medical records, you have 2 different ways of getting the clinical records to us. You could fax that information in to us, or you can actually upload that information through our online portal through radmd.com. If you are going to be faxing in the information, you will have to use a fax cover sheet. Over here on the right-hand side is an example of the fax cover sheet. The way the fax cover sheet works is the actual tracking number that's associated with the request itself will be at the top of the form. It allows our fax servers to automatically take all that clinical information and automatically attach it to the patient's records. If you're uploading the information, it's going to be a similar process. You'll enter the tracking number, patient's information, and then it'll get to an upload screen where it allows you to actually upload the patient's records, medical records. So this is the prior authorization process. You can see it's up to a 3-step process. We have our intake level, our initial clinical reviewers, and then we have our board-certified physician clinical reviewers. Now at the intake level, you can see there's the telephonic and RadMD. Those are your 2 different ways, again, to initiate a request. At that level, the request may approve. It may require additional review or pen for the validation of the patient's medical records. Now, when the case does pen, you would be given a tracking number. And then once we receive the patient's medical records, that information will then go on to our initial clinical reviewers. These are our nurses who would actually review the clinical information at this level. If there is enough information at this level in the records, the nurses may approve or send on for additional review. Now, the peer-to-peer process, when our board-certified physicians are actually reviewing or requesting a peer-to-peer discussion, at this level, this is the only level a request can actually deny. And of course, the request can also approve. Peer-to-peers should not be occurring that often if you are supplying the appropriate clinical information in the patient's medical records. So if you are having a lot of peer-to-peers, there's some frustration in the office. Again, my card's out there on the table. You can get my information. We'll walk through the guidelines. We also have a full clinical staff, so if you have any ordering physicians that are having a difficult time with the actual guidelines, I can help coordinate and set up meetings with our medical directors and the physicians there in the office to really help understand the entire process. So again, remember the peer-to-peer process should only occur when the appropriate medical information is not in the patient's records that's being sent to us. So a little bit about both the telephonic and our online capabilities. Our 800 number here is listed right here. It's for both the advanced imaging, cardiac, and for those spinal surgeries. It's available from 6 a.m. to 6 p.m. That's Mountain Daylight Time. And then we also have our interactive voice response system. So this is for when you have a tracking number and you want to check on the status of a request, you can go call our 800 number, enter the tracking number, and it'll give you a status update. That also can be done online too. So if you're ever checking on the status of a request, you can actually go to radmd.com. On the right-hand side of the page, you'll see track and authorization. You can enter that tracking number and also check on the status of the request. Now, on our website, on radmd.com, it's available 24/7 except during maintenance. Usually maintenance occurs on Saturdays and Sundays, usually late in the evenings. But on our website, the ordering doctor is able to request authorizations online. They will have to sign up for a user account. It's a simple form that you fill out, and then you receive a follow-up email that will then grant you access to online capabilities to order request. Being an ordering physician, you'll also be able to upload the clinical information. So when a case does pend, you could actually, we'll give you the option to print out a fax cover sheet or upload the patient's clinical information. On our website too, on RadMD, we have all of the clinical guidelines that are important for the physicians to review and office staff. We have our frequently asked questions. We have our quick reference guides. We have checklists, tip sheets. All that information is actually out there today on our website, so if you actually want to take a look at it, I can point you in the right direction. We're going to have a number of provider webinars. My contact information is out there on the table, so if you have questions after the meeting today, feel free to call me, contact me. I'll be more than happy to answer any other questions. Okay. Thank you.
Thank you, Kevin. Appreciate your time.